We are going to go. We are going to go over today's RFP for the 377 board. Okay, so for the 377, the request for proposal, the grant cycle is for calendar year 2021 from January 1st, 2021 through December 31st, 2021. And this was posted on August 10th. The request for proposal range, the time allowed to be able to turn in the offer for the RFP is from August 10th through October 9th, 2020. So the invitation to bid is on behalf of the 377 board or the McLean County Board for the Care and Treatment of Persons with Developmental Disabilities. After this point, we're just going to refer to the 377 board as the board. One of the things to definitely remember that is addressed in the RFP is that any request for proposal applications that are turned in must address service outcomes for clients with developmental disability, intellectual disability, or those deemed at risk of a developmental disability. And the services received in that program cannot be services or duplicated services that that person would be eligible to receive from the school. So the board has identified 6 broad focus areas. And so the RFP, the proposal can be part of one of the following six program focus areas. The first one is supported employment. And the information on what supported employment would entail is part of the request for proposal that agencies can review. The second focus area is supported living. So for supported living, the residents in this program shall be at least 18, diagnosed with an intellectual and or developmental disability, live or assessed in need to live in group homes, apartment, duplex, or individual settings situated throughout McLean County communities. And so the parameters of what those homes would look like are identified in the RFP. However, funding within the supported living can provide for the following services, but this is not an inclusive list. It can be for case management that assists the person with assessing community resources, including mental health services, recreational activities, benefits, medical care, etc. It can be training from trained direct support professionals in the areas of independent living, community integration, economic self-sufficiency, and self-medication. It can also be accommodations and equipment to assist residents, to help residents adjust well to their home environment and participate in community activities. And it can also be teaching self-regulation and coping strategies, or providing services to residents to address their basic needs, including laundry, food, shelter, etc. The third focus area identified by the 377 board is pediatric therapy. So the age range is identified in this focus area. Pediatric can include assistive technology, audiology, developmental therapy or special instruction, health consultation, medical services, nursing, nutrition, occupational therapy, physical therapy, psychological counseling services, service coordination, sign language and cued language, social work, speech language pathology, transportation, vision, and or translation, interpretation to other languages. So delivery of these services shall meet the child and family's preferences, learning styles, and cultural beliefs. So in the pediatric therapy focus area, funding could be provided for the following services. And again, this is not an inclusive list: one-on-one therapy, therapy via Zoom, group therapy when appropriate and best practice, interactions with the child and family to provide education, intervention, and environmental support. The children's natural setting shall be the main location of services unless otherwise appropriate and best practice. Monitoring, including evaluation and reevaluation of child and family's needs, assistance and review of activities for parents or caregivers to do with the child, consultation, including the therapist providing training, evaluation, or assistance regarding a specific challenge for a child, transitioning planning no later than the child being 2 years, 6 months old to assist with preparation of the child no longer being able to receive early intervention services. And services within the youth category, or excuse me, services within the pediatric category shall be performed by qualified personnel. The fourth category identified is youth services. Participants in this program can be from birth to 22. And then the youth participating in this program may have been assessed to have a developmental delay that requires additional support. They may be diagnosed with an intellectual and/or developmental disability. They may be assessed to need an evaluation for autism spectrum disorder and/or other evaluations to support their developmental needs. They may be assessed to need a program to increase the proportion of skills gained by a child with an identified developmental delay. And for youth services, the funding in this area could be funded for the following services, but again, not an inclusive list: autism spectrum disorder diagnostic clinic, youth counseling services within home, school, and the community or at agency, intensive family support service programs to support children and their family, home visitation program using parents as teachers. The services may include assessment, treatment planning, case management, therapy, counseling, parent coaching and support, education on trauma as it relates to intellectual and/or developmental disabilities, education on mental health if diagnosable mental health disorder exists, teaching self-regulation and coping strategies, community support services, including linkage to food and utility services, and assisting in assessing health-based services, services individualized to meet each child and child's family needs, attend school meetings, including IEP 504, teacher classroom support and collaborations, nurse support and collaboration, support inclusion, reduce likelihood of abuse and neglect, family goal planning, referrals made to appropriate services, wraparound services, navigator, etc. So in the youth services area, really promoting those programs that would help benefit the child with an identified developmental delay and/or diagnosed developmental disability to be able to respond well within their means. The fifth category is adult services. Adult and the age would be identified in the proposed program description. Adults to participate in this program may have been assessed to have a developmental delay that requires additional support, and/or they may have a diagnosed developmental delay and/or intellectual disability, a developmental disability or an intellectual disability. And provided is a list of services that can fit into this program. And again, it's not an inclusive list, but for adults, it could also be autism spectrum disorder. It could be adult counseling services within the home. It could be within the home, in the community, and/or the agency. Intensive family support service program to support children and their family. Home visitation program using teachers as adults for an adult with an IDD that is prenatal, pregnant, or caring for children. Services may include assessment, treatment planning, case management, including transportation, therapy, counseling, parenting, coaching, and support, education on trauma as it relates to ID/TD, education on mental health if diagnosable mental health disorder exists, teaching self-regulation and coping strategies, community support services, services individualized to meet each family's need, supports inclusion, including through community-based activities, reduce likelihood of abuse and neglect, family goal planning, and referrals made to appropriate services, wraparound services, and navigator. So programs that would support adults, including adults that may have intellectual disability and or developmental disability that are prenatal or pregnant and would need that could benefit from additional support. The last category identified is COVID-19 support. So funding in this area would be for would benefit individuals that have a developmental delay, intellectual disability, or developmental disability. And these programs that would be included in this area may assist individuals to cope with lifestyle changes as a result of COVID, provide teaching and support on practicing recommendations to promote safety and prevention of COVID, assistive technology supports to assist in receiving services that may not be able to receive in person and or safe to receive in person, services that will assist in promoting wellness, healthy mental and physical health, and safety as a result of COVID-19. Eligibility information is the next area on the RFP. The 377 board is comprised of a 5-member board appointed by the McLean County Chairman. And as far as a potential vendor with the board, the following is the eligibility requirements. The vendor shall serve McLean County residents regardless of their ability to pay, shall practice evidence-based assessment and tools for treatment and interventions, provide trauma-informed care approaches to staff and participants. Vendors shall provide health equity practices. Vendors shall engage in inclusion practices, including identifying racial demographics of service area and inclusion plans to promote program service statistics or closely representative of service area. Vendors shall engage in cultural humility practices. And successful applicants must demonstrate they have the necessary facility infrastructure to support the proposed program and enough qualified staff, including a qualified supervisor, and that the program will begin on the start date of the contract, which will be January 1st, 2021. The next area of the RFP is mandatory requirements. If an agency is interested in completing an offer package or in response to this RFP, they would email Amy Hancock and would be provided with the mandatory forms to submit the RFP proposal. There is also a mandatory presentation that would be provided for each program that is to be held on Thursday, October 29th. Agencies submitted applications shall have 15 minutes to present their program to the board and then answer follow-up questions. Any modifications to the RFP proposal and/or application will be sent to vendors that requested mandatory forms. The due date, time, and address for submission offer is included in this area. To submit the offer, you would submit it to the HD Financials email address located in the RFP. The due date and time of the proposal is October 9th by 11:59 p.m. Central. Late applications will not be opened or considered and will be automatically disqualified, but will be retained by the health department. The health department will notify all applicants whose application will be considered because of lateness or other non-compliance with application preparation or submission requirements. The next section is on vendor questions and solicitation contact. Right now, we are having the virtual question and answer session to review the RFP and their mandatory forms. Any questions outside of this virtual meeting should be provided to the solicitation contact in the RFP. So the individual listed below shall be the single point of contact for the solicitation. Unless otherwise directed, do not discuss the solicitation or proposal directly or indirectly with any board member, McLean County government employee, or McLean County Health Department employee other than the solicited contact. And the solicited contact information is provided in this area. Your questions and answers will be posted on the behavioral health website for other agencies to be able to receive the same feedback. The review and selection process is the next area. The board will use the matrix to grade the content in the offer. The matrix is a tool in the funding selection process. However, the matrix is not the only deciding factor in the funding process. The 377 board will meet in November to decide which applicants that they will propose to receive funding for calendar year 21. That information will be included in the McLean County Health Department budget, and the budget will need to be approved by the McLean County Board in November 2020. Official offers or official awards cannot be granted to agencies and/or programs until November 2020 after the McLean County Board has approved the budget, the McLean County Health Department budget. After the budget is approved, and if your agency's program is approved by the 377 board to receive funding, a service agreement and/or contract would follow. Negotiations would occur during that service agreement process. This chosen vendor agrees to negotiate with the health department in good faith to enter into a service agreement and the service described in the offer. The service agreement shall be returned to McLean County Health Department by the time and date designated by the McLean County Health Department. Any part of this RFP, request for proposal, any information that is provided in this request for proposal will be transferred, carried over into the contract. Acceptance of grant in accordance with Illinois law governing the award of grants. Board reserves the right to accept or reject any and/or all proposals for any reason and to award this project to a single agency deemed most beneficial to the board after completion of review of proposals received. The board and/or McLean County Health Department may withdraw this RFP at any time prior to the actual time of fully executed service agreement and/or contract is executed. The next part of the RFP is on public information because we are part of the McLean County Health Department, and 377 board is part of McLean County government. We do have to follow the Illinois Freedom of Information Act. And so please review that if you have any questions as far as how your offer could be viewed by others. And the last section of the RFP is on equal employment opportunities, and please review that for any feedback or questions. That is the request for proposal. The next document that we are going to look at is the application or the proposal. If an agency is interested in applying for 377 funding, they would contact the person identified in the RFP, and they would then receive this application and the budget that goes along with this application. So the directions on how to complete this application are included in the very top. And then as far as the application, you are to identify which of the six funding focus areas you are applying for. You can apply for more than one program under any focus area, but an application would have to be completed for each program. You can also apply for different programs within different focus areas. But every program that you apply for must fit within one of the parameters of the focus area, and an application must also be completed for each program. The information identified in the first part of the application is the information of the agency, to be able to contact the agency, the director, the program director, the executive director. There's a short section on agency overview to provide information on that. The main section of the application is on program description. And so this will have the most weighted amount in terms of the 377 board reviewing the application. And so the program description just really outlines the program that your agency is requesting to be funded or partly funded by the 377 board. And this gives the 377 board information on what would be included in that program and what would the services that would be delivered. In this part, you would include how many individuals that you plan on being able to provide services to based off of 377 funding. This section also gives you a chance to really include how your program will be inclusive of diversity, demographics, health equity. So it gives you a chance to really be able to explain all of those parts in the application. So there's questions that go through this, including a section on COVID-19 in the application. And so as a result of COVID-19, we know that programming and services have changed and will continue to be altered moving into 2021. So part of your program description will include identifying how the program will be delivered regardless of what COVID-19 phase we are part of or we are in. Including also back to assistive technology, ensuring how clients can participate in telehealth services if that is applicable. And the program is to start by January 1st, 2021. However, it's in the application, in the program description. If you do not feel like that you can provide services by that date, you can provide information why. Also, back to the eligibility requirements. In the application, it gives you a chance to describe the trauma-informed care initiatives, including training that your agency and staff is taking on to make sure that you are able to provide those services. The next section is on program objectives. This section is different than it was last year. And so this year, the agency will write outcomes, objectives and outcomes. The directions on how to write objectives and outcomes are identified in this section, but the agency will write objectives and outcomes that they will strive to achieve during calendar year 21, and then the board will review this. There should be plenty of area in this part to write your objectives and outcomes. However, any formatting needs, you would contact the solicitation contact on your RFP, which would be myself, Amy Hancock, and we will ensure that you have a format that you can include all of the information you need to. And then just ending the objectives and outcomes is identifying how these outcomes will be used for evaluation of your program and how you will plan to carry out the objectives and ensure that the objectives are being met. There's also a short part on collaboration. And so this is just your chance to show your collaborative efforts within the community and within other agencies. The next section is on financial management, which includes the budget Excel worksheet that needs to be completed. And so financial management is the area that you will identify how much money you are requesting on behalf of the 377 board, identify other revenue and revenue streams and expenditures within the program, and to be able to just show the overall financial health of your agency and the program, including efforts that your agency takes to ensure that there is revenue coming into your agency and into the program to support services. A new section this year is on sustainability. It's a very small sustainability plan on your application that identifies a plan for community sustainability, financial sustainability, and organizational sustainability. Your executive director will need to sign this application or this proposal, and then the proposal would be scanned in along with the completed budget, and that would be sent to the email identified in the RFP. So that is all of the information as far as the application and or proposal. The last section that we are going to cover is the budget. The budget is part of the mandatory form. It's very similar to a budget that has been completed, that was completed for this year and last year. However, we're going to go over it. One of the qualifiers is that for the 377 funding is an agency does not have to be receiving funding from the 377 board, or does not, you did not have to receive funding in the past. So we'll go over the basics of the budget. So as far as the budget, the purpose of the budget is to look at the funding that you're requesting on behalf of the 377 board, where that funding is going to be allocated and the different funding areas or the different funding categories, and also funding that you are planning on receiving from other funders and or fee for services and expenditures of the entire program. So it's looking at the 377 board piece, but it's also looking at the entirety financial health of the program. So on the budget, you would put, of course, the name of your program and agency. This first tab, there's several different tabs. This first tab is identifying the amount of money that you are requesting on behalf of the 377 board. This also then shows the different categories that are allowed to be funded or requested for funding within the 377 board. You would put the total amount for each category area that you're looking into being requested from the 377 board. As far as indirect costs, the indirect cost is capped again at this year at 10%. So this first tab is focused on McLean County Health Department or 377 funding. The second tab is focused on revenues and expenditures outside of the board, outside of the 377 funding. And so this is where you would put how much you are planning on your agency receiving in revenue and cash, non-cash, other funding and contributions. And so how much total revenue outside of the 377 board that you plan or predicting that your program would receive. And then again, the funding categories, how much you are planning on, how much money and expenses you're planning to have in the categories outside of the 377 funding. Under each tab is a funding category broken down into identifying how much money would need into each allocation area, into each line item. And then this would allow for transparency for the board to see on how you came up with the amount you did in each category. So for example, the first one is on personnel. Each of these funding focus areas or each of these funding categories or allocations will have a description provided for you at the top. The first part of the Excel worksheet is a tool to help you assist you in coming up with a total for that line item that would be from 377 funding. And then the second part of that worksheet is identifying expenses that will not be supported from 377 funding. And so then that gives us the total amount that you think will be needed, for example, for personnel within that program. And then the last part of each tab or each worksheet area is identifying is writing a writing a narrative for each of those sections. And so then that helps the 377 board identify why you are stating that the program staff are needed for that, why the program staff you identified in this area are needed for this program. So again, the first tab is on personnel, benefits. Each of these areas has the same format. Regarding the top, has the description of what you can apply for in that category. Then the worksheet includes a spot for McLean County Health Department funding, non-McLean County Health Department expenditures, and then a narrative. And you will continue on through the worksheet to complete each section, including travel, equipment. In all of these categories, identified have to be in relation to the program. They have to benefit the program in some way. And so then for equipment, if you identify equipment needed to support the program, then you would need to provide a description also in the narrative to help explain to the board as to why that equipment is needed for that program. Office supplies needed for the program. And again, description is provided. The narrative is needed in each. There's a section for McLean County Health Department and non-McLean County Health Department. There is a section for contractual services. However, the 377 board does not permit for services being funded to an agency to be subcontracted out. So contractual services would not include services that would be subcontracted out to another agency. There's a section for telecommunications, including assistive technology. There's a section for training and education. Again, it gives a description of what training and education would include. And this would need, training and education would need to benefit the program. And then there is a section on providing a narrative. If you are looking at just receiving funding for a specific client care cost, then you would put that in this category. There is an area for indirect administrative costs. Again, the cap is at 10%. And so you can put 10% of the total cost of funding that you are requesting to receive from the 377 board. And if you have a higher indirect cost, then the 10%, you would include the remaining of that expenditure and the non-MCHD total, and you can explain that in your narrative. The last page should be populated for you after you have completed the entire budget. It will include the money from each of the budget categories from the health department or the 377 board, expenditures that you're looking at in each of those categories that would not be funding from the 377 board. And then there would be the total of the health department or 377 board, other expenses. So the total project cost should be populated. And in the yellow is the total cost of the program. So that is the section on the budget. Just a reminder that as you're completing this, really focusing on how each of the funding, how each of the budget categories is focused on providing services to individuals with intellectual and/or developmental disabilities specific to the program that you are proposing to be funded. That is the conclusion of going over the request for proposal, going over the actual proposal or application, and going over the budget that is part of the entire package of that proposal. So the offer includes the application and the budget. If there are any questions that were not addressed in this recording, please refer back to your RFP on how to ask those questions, and they will be followed up. Thank you for your time. Have a great day.